This lesson relates to measurement problems that can occur in reports of statistical data. After completing this lesson, you will be able to identify the following 4 measurement problems in a statistical report. Note that Joel Best separates creating and technical measures. However, given the degree of overlap between the two of them, we will combine them in our discussion in this class. I'll discuss each of these in turn. Let's start with creating technical measures. After defining the measures that you'll use to evaluate a statistic, you will need to determine how to measure those variables. Different measurement choices can produce different results. According to your reading in the Joel Best textbook, when creating measures, they may be too restrictive or too broad. Identifying problems in measurement choices requires a little more digging than when finding definitional problems. However, it is important when reading statistical reports to look for numbers presented without sufficient information about measurement choices, and to ask yourself how different measurement choices might yield significantly different numbers. An example of this can be seen in the following statistic. Obesity is set to overtake smoking as the leading cause of preventable deaths. In a study conducted by the CDC in 2004, smoking caused 435,000 deaths in 2000, whereas being overweight caused 400,000 deaths. The researchers projected that by 2005 the toll would surpass 500,000, which rivaled the number of deaths from cancer. However, in 2005, a second set of researchers found that being overweight caused only 26,000 deaths, which is about 1/20th of what the other researchers predicted. These stark differences in findings related to the fact that both sets of researchers used different measures to evaluate obesity. Both sets of researchers used the same population to generate their estimates, but the first set of researchers used a measure for obesity on the BMI that resulted in more people being sampled. Whereas the second set of researchers restricted their measure of obesity to a much lower value that differentiated obese individuals from overweight individuals. Adjusting the cutoff for the BMI made the estimates generated by these two sets of researchers starkly different. This example helps to illustrate how different measurement choices might yield significantly different numbers. The second type of measurement problem that I'll discuss is referred to by Joel Best as unit of analysis. This refers to the level at which data is measured. We often measure data at the individual level. This means that the values represent data from one person. However, this is not always the case. We can also measure data at other units such as families, countries, states, cities, corporations, school districts, etc. Let's look at an example. This is what a sample data set may look like of 5 different students in a class and their ages. This data set is at the individual level of analysis, in which each row represents data from a student. This is what a sample data set may look like of 5 different universities and their average ages. This data set is not at the individual level of analysis. It is now at the level of analysis of the university, in which each row represents data from a university. Understanding unit of analysis is important because there are often times in which changing the unit of analysis can lead to a result that should be interpreted differently than if the analysis was done at the individual level. In our example on ages, switching from a student's data to university data would lead to having much more variability in the ranges of ages for each estimate. As we go higher in our unit of analysis, we will encounter much more variability. Ignoring such variations in these estimates could produce misleading results or interpretations. Let's put this in context with an example. According to a report presented by your text, meth is the country's #1 drug problem. I'm sure many of you may find this surprising, given that meth isn't the drug that's often discussed in the news. The data for this statistic were gathered in a random survey of 500 sheriffs in which 48% reported that meth was the country's primary drug problem, whereas the other 52% were split among other choices. The key problem here is that data were collected by asking a representative from each county to participate in the survey. States in the United States with large rural areas often have more counties than states with densely concentrated populations. Because data were measured at the level of the county, there was an overrepresentation of rural areas in the sample, and meth tends to be the drug of choice in rural areas. This statistic helps to highlight how examining data with county as the unit of analysis resulted in a different conclusion than when examining the total number of drug users, which would be at the individual unit of analysis. When reading statistical reports, be sure to look out for unusual units of analysis that might affect the results. The third type of measurement problem that I'll discuss is loaded questions. Loaded questions suggest that the data that you measure can be influenced by biases in the data collection process. Loaded questions are often the problem when individuals in completely different camps both claim to have the majority of support on an issue. Let's look at some ways in which questions may be loaded. One way a question may be loaded is based on the order in which questions are asked. Even questions that seem unbiased can be biased based on an order effect. Here's an example of this from the Huffington Post. The statistic reads 33% of registered voters favor the Democrats' health care reform package, whereas 55% are opposed. The question asked to gather this data seems fairly unbiased. The surveyors asked, based on what you know about the health care reform legislation being considered right now, do you favor or oppose the plan? However, when you look at the actual survey, you can find a host of other questions that are biased. Having these questions precede the neutral question can actually set a tone in the minds of the responder. Even though they may favor the healthcare legislation, they may be less likely to do so after being asked this line of questions. Another way a question may be loaded is based on who is asking the questions. For example, a study based on surveys in Morocco found that the gender of the interviewer and how that interviewer was dressed had a big impact on how respondents answered questions about their views on social policy. The results showed that both men and women reported less progressive attitudes on gender equality when the person asking them questions was wearing a religious headdress. Also, women had more progressive attitudes on gender equality when questioned by a woman than when questioned by a man. A third way a question may be loaded is based on how the question is worded. Your text discusses this in the context of school vouchers, but a classic example of this can also be found in the eyewitness testimony research. Largely different estimates of speed were reported when eyewitnesses were asked how fast the car was going when it smashed into the wall versus when it hit the wall, in which individuals reported the car going much faster when the question was framed as smashing into the wall. The following slides summarize 6 other ways that questions can be loaded based on how they are worded. Badly worded questions tend to be leading by suggesting the correct answer within the question. Badly worded questions may also push you to answer in a particular direction. This can be subtle or more overt. Badly worded questions confuse people by being easily misinterpreted. The first example here shows the use of a double negative. This can be very confusing for survey respondents to determine what they are answering. The second example shows how questions can also be confusing by being too wordy. This question is so long that at the end of the question you've forgotten what was being asked at the beginning of the question. Badly worded questions may also confuse people by including jargon or difficult terms. It is often advised that questions should be designed for a 12th grade reading level. Badly worded questions may contain multiple questions in one. This is referred to as having a question being double-barreled, in which you cannot answer one question without also automatically answering the other. Keep these issues in mind when evaluating the questions used in a statistical report. The final measurement problem I'll discuss is that of raising the bar. This describes having changes in estimates due to changing standards over time. Joel Best describes this in relation to clean air and how air quality has become worse, not solely because of more pollution, but also because of our changing standard on what air quality we find acceptable. A similar example of how changes in measurement standards can lead to misinterpretations can be seen in the following statistical report. Washington, D.C. has the highest percentage of HIV infection in the country. At first, this statistic seems somewhat ominous. However, a closer examination of the measures shows that it isn't that more individuals are being infected with HIV in Washington, D.C., but rather that individuals with HIV are living longer due to better medical advances in this area. The measure of HIV infection is therefore inflated due to a raised bar in the medical field. In summary, these are the 4 measurement problems discussed in your text. Be sure to keep them in mind the next time you read a statistical report.